Hi, and welcome to the Pink Movement podcast with your host, Christy Collier. Each episode, you'll hear from some awesome people in and around the breast cancer world, sharing their wisdom on all things health and well-being. You'll hear simple information, practical advice, and useful tips to help you stress less, move more, and feel better.
Thanks for joining me on this episode of the Pink Movement podcast. I'm your host, Christy Collier. Today, we're talking about looking after yourself when you're undergoing treatment. Now, I'm chatting with the inspiring Lou James, who has created this worldwide network of pink physiotherapists to help women with breast cancer. Lou shares with us why she is so passionate about helping people with cancer and how she has developed her specialised programs. As an expert in cancer rehab, Lou then reveals her top 10 tips for looking after yourself when you're undergoing treatment. And there are some surprises in there, including learning to breathe. These tips are absolute gold, so get comfortable and get ready to take it all in. When it comes to cancer rehabilitation, Lou James is a pioneer, an experienced physiotherapist, physical trainer, and Pilates clinician. Lou is responsible for the introduction of the Pink and Steel cancer rehabilitation programs. To date, the programs, which focus on the physical and mental well-being of people affected by cancer, have supported more than 10,000 people. The PINK program was originally developed to help women recovering from breast cancer surgery and treatments and is now open to all women with a breast cancer diagnosis. It includes assessment by a certified PINK physiotherapist and a personalised rehabilitation program to suit their stage of treatment or recovery. Lou has also developed Next Steps, which is a group exercise program combining Pilates, yoga, and cardio exercises, and Paddle On, a group stand-up paddling rehabilitation program. Lou is dedicated to helping improve the lives of people affected by cancer. And personally, I couldn't be more thrilled to have her joining us on the podcast today. So Lou, welcome, and thank you so much for joining me.
Thank you very much, Christy, and thank you for that wonderful introduction.
No problem, my pleasure. Now, look, today's topic, we're going to be talking with Lou about taking care of yourself while undergoing treatment. But before we dig into that, let's learn a little bit about this amazing lady. So, Lou, please just tell us a little bit about yourself and your background and how you got involved in what you're doing today.
So I'm a physiotherapist, and I have spent the last 12 to 14 years working with cancer rehab. And I initially started the program in my own physiotherapy practice, and I saw a number of women with breast cancer, and I couldn't believe, one, the effect of the effect their treatments had on them physically and emotionally, but secondly, the lack of support that they had in terms of their recovery or knowing how to help themselves during the treatment and knowing how to get back into their lives after their treatment had finished. At the time, I was working with a lot of sports stars, and the difference between the care was completely opposite. So I started working on helping women with breast cancer through my physiotherapy clinic. I am also a Pilates clinician, so I used Pilates, I used lots of different physio manual therapy techniques and exercise therapy, and couldn't believe the results that I got. And it didn't take long until my practice was really full, and I started to think the best way I could help more people affected by cancer was to train other physiotherapists how to help. And in the physiotherapy degree, we don't actually get training in terms of cancer rehabilitation. So I set up a postgraduate training program with Pink and Steel International to help train physiotherapists worldwide how to help people affected by cancer improve their outcomes and really get back into a good quality of life.
Gee, that's amazing. Really interesting to hear you say there that in the physiotherapy degree, the initial degree, there's no specialisation in the cancer space. So that's something that you had to go and research and develop yourself.
Yes, there's very little in terms of cancer rehabilitation, and it's a very new field. And one of the reasons is because, cancer used to be terminal, and now it's not. Now many more people are surviving, particularly breast cancer. And so there's become a whole new field, which is the survivorship field. And, the treatments are effective, they're working, but they are leaving people with long-term consequences if they don't get rehabilitation.
Yeah, absolutely. And also interesting to hear you say, you're working with elite sports people and the care and the treatment they get is second to none. Yet the care and treatment available for those with a breast cancer diagnosis or other cancer diagnoses is limited. And it still is, it's definitely growing. There's services like yours out there and there are others. But we've got a long way to go till we're at that, that really capacity of being able to help everybody.
Absolutely, there is a long way to go. But one of the big things is, people need to understand that they can take some control back during the treatment, and they can, learn ways of looking after themselves and to go and seek help to try and get that support.
Yeah, absolutely. And it's something I'm really passionate about personally, which is, obviously there's all the work that the medical professionals and science and medicine is doing for you, but there is things that you can be doing for yourself. And it's really important to have that little bit of, I suppose, self-awareness and, help yourself as much as possible.
Absolutely. And I think, it's a very difficult stage. Getting a cancer diagnosis just turns your life upside down and affects the treatments are affecting every system of your body. So it's very difficult. And, people may go through things at different times, but no one breast cancer diagnosis is the same.
Yeah.
So you can't compare yourself to someone else, and you can't, just expect yourself to be like another person that, everyone is completely different and their rehab needs to be different. So you must make sure that you get individualized care that's directed at you particularly.
Yeah, absolutely. And so obviously, Lou, following on from that sort of little intro you gave us there, you have been instrumental in the development of the Pink and Steel rehabilitation program. So I'd love for you to sort of share with us how that came about and what's happening in that space with those programs at the moment.
Yeah, so as I said, I was working in my own physiotherapy clinic and thought, there must be a way I can help people in terms of recovering from cancer. So the Pink program that I've devised is in 4 phases actually, and the first phase is pre-op. So if a physiotherapist can actually see someone before surgery, we can actually help people in terms of strengthening muscles, letting them know what they're going to have to do before the surgery. The next phase is post-op, so that's helping people recover as fast as they can after the surgery, again knowing what things that they can do for themselves and what things that they may need help with. And the next phase is during treatment. So a lot of people come and see our physiotherapists during treatment, and we have really good results and outcomes if we can keep people active and keep people moving throughout that phase. And then the last phase that we look at is we call the fitness phase, and that is for when the treatments are finished. And as you mentioned before, there's some other programs that I've developed called Next Steps and Paddle On, which again are trying to help women in those phases, because people are surviving cancer, but the effects of their treatment last for a long time. And so being able to help them, further along their recovery pathway, I think is really important to keep going and keep looking after themselves.
Yeah, absolutely. And I love how you mentioned it, I think, earlier about it really being there's no 2 cancer diagnoses, no 2 that are exactly the same. So having a personalised, individualised program or seeing somebody with that unique approach is so beneficial, which is really what your peak rehabilitation program, by working with a physiotherapist, comes into it, doesn't it?
Yeah, so what our physiotherapists do is that they assess the person. So it depends on the stage of the recovery, it depends on the type of cancer, it depends on the treatment that they've had in terms of what the rehab program may look like. So as I said, it could be post-op, so it could be physiotherapy techniques that help in terms of range of motion of the arm or the effects of the surgery that the surgery has had. It might be reconstruction surgery or surgery to remove the cancer, or it could be more of movement therapy in terms of during treatment. So during treatment, it's really important that people avoid inactivity. And by keeping them active, they're able to reduce some of the side effects of the chemo and make them, sleep better, make them less nauseous, make them feel less anxious, make them feel more in control. So there's a whole lot of things that by working with people during their treatment to keep them well, they can feel better going through it, but also they get through their treatment and are better at the end of it, so that they're more likely to be able to get back to work sooner or go back to doing the things that they love doing, like, socializing with their family or playing with their grandkids or all those sorts of things. If you can have treatment, rehab during treatment, you are much more likely to get through it in a better position rather than being totally fatigued, deconditioned, and then really needing to start from ground zero to get yourself back. And then the next phase we look at in terms of recovery is fitness, and that really does depend on, again, what type of treatment you've had, what you've done during your treatment, what sort of your fitness levels and things you want to get back to doing. Some of our women go on to do marathons.
Yeah.
Other women aren't interested in doing a marathon, but they want to be able to get back and make sure they can hang their washing on the line and do normal acts of daily living without having pain and without feeling fatigued. So depends on where people are at in terms of what we're trying to get them back to doing.
Yeah, I mean, that's great. I mean, everybody does have such different fitness goals or even just movement goals at the end of their treatment and once they're sort of through and looking to sort of rebuild their life after that. So understanding that and working towards that is really important as well. And obviously when you're working with a qualified physiotherapist in that one-on-one capacity, it allows them to do that.
Absolutely. And I think, one of the big things that's kept me going and why I'm so passionate about the work that our physiotherapists do is there's so much amazing research about the benefits of exercise for people with breast cancer.
Yeah.
And, even very recently there was a review that I looked at which reviewed about 70 articles which addressed lifestyle modifications that might have an impact on the risk of breast cancer reoccurrence and survival after breast cancer.
Mm-hmm.
And they found that regular physical activity can reduce the risk of dying from breast cancer by 40% compared to women who didn't exercise. I mean, that's amazing. And if that was a drug, you'd be taking it.
I know.
But also it does mention that less than 13% of women with breast cancer actually achieve the recommended weekly exercise physical activity, which is about 150 minutes. So, a lot of people are actually exercising less after they've had cancer. They've got barriers and they need help in terms of knowing what to do. But the other thing about, exercise, it can prevent reoccurrence. It can help with things like weight management, but it can also reduce, side effects from things like chemo, radiation, and hormone therapy. So, so many of those treatments have horrible side effects. And if exercise can help that, it can just really improve people's quality of life, but also their survival. So it's so important, and that's the basis of why our physiotherapists work with people one-on-one, try and break down the barriers that they need so they can actually exercise. And and exercise doesn't have to be going to the gym. It can be anything that people really liked in terms of being active, and we try and work with people to address that so they're actually doing activities that they love. Then they're more likely to do it.
Yeah, I love that. I mean, and it doesn't have to be structured. It can be power walking. It can be, walking the dog. It can be gardening for an hour. It can be, as you say, getting that recommended amount per week. All the research points to, God, it's so many amazing benefits for those with a cancer diagnosis. So, yeah, it's really interesting. As you would probably know, the more and more research done in that space, the more it's all pointing to those same results, which is it just has such a huge impact. And,
absolutely.
It's so important for the average person to be, moving on a daily basis, but I think it's even more important for, anyone with a breast cancer or a cancer diagnosis.
Yeah, it is. It is in terms of short-term effects and long-term effects. So the long-term effects of a breast cancer diagnosis, can affect your cardiovascular health. It can affect your bone health. It can affect even your brain. So it can affect all your musculoskeletal systems and systems of your body. And and if we get people back exercising and we can reduce some of those long-term consequences, then their quality of life will be better longer and they're likely to live longer. So it is really, really important. But I suppose the key thing in terms of cancer rehabilitation is that there's some essential things and symptoms that people must get addressed before they go back into, more vigorous forms of exercise, maybe that they've done before, just to help them so that they don't, they don't get injured and they can safely get back into doing it.
Yeah, absolutely. And Lou, just tell me a little about your Paddle On program. And I'm a dragon boater. I'm involved with the Dragons Abreast program. So I'm
awesome.
Really interested to hear about that and how that's come about and how that works.
Well, I absolutely love Paddle On, actually. I love love, I'm an outdoor enthusiast, I could say, and I love getting outside. And I think, the benefits of actually being out on the water are huge. And you all know that from dragon boating.
Yeah.
But so Paddle On started actually, I was approached by some people that had that wanted me to develop the rehab program on paddleboarding, and I didn't know how to paddleboard. So I said, well, firstly, I've got to learn to do that. And I have to admit, I absolutely loved it from the first time I hopped on the board. And from my, physio and Pilates background, I realized just how beneficial actual paddleboarding can be for your whole body in terms of your core strength, your upper body strength, your lower body strength, your shoulder and thoracic flexibility, your stamina, your balance, all those sorts of things that the cancer treatments can affect. Paddleboarding actually can restore if you do it right. So I was really excited by that, but also just the psychological benefits of being out on the water and the relaxation, the sense of calm and being out there in nature, how good that is for your mental health as well. So I think it's such an awesome form of exercise. And so we first piloted it with women with breast cancer. It was funded by the New Zealand Breast Cancer Foundation, and we piloted it with 60 women 3 years ago now, and we got such fabulous results. And a lot of the really positive part of the results for me was the fact that it actually really motivated people to get back into exercise, not only paddleboarding but other forms of exercise as well. It even improved cognitive abilities and memory, which I thought was outstanding. But I think it's because of the using the paddle and different and coordinating different sides of your body and learning a new skill gives you confidence, and just also the group setting is really great for people in terms of support from other people that have been going through the same thing. And lots of the women actually ended up joining each other in the mornings to walk in the days that they didn't do paddleboarding, and then quite a few of them actually bought paddleboards and now are still paddling from that pilot program, and they just love it. So it's such a cool form of exercise, and every time we run a program, I'm actually astounded by how wonderful people find it and how much it boosts their confidence and how they really just love the program and want to keep going. So we've had women that keep coming every year. We've had women with all types of cancer doing it now, but also women with metastatic breast cancer as well are doing that program and really benefiting from it, which I think is fabulous.
Oh, I love it. I absolutely love it. I can't wait till it makes its way to Australian shores so that I can have a go and get some of my dragon boating buddies to have a go as well.
Oh, absolutely. You'll love it.
Yeah. All right. Well, let's get into our topic for the day. And today we're going to be talking about taking care of yourself while undergoing treatment. And Lou, you've got 10 great tips for our listeners on this. So fire away.
Well, I think, number one is listen to your medical team and not Dr. Google. So as I said, every single person's cancer is different, even those diagnosed as the same type and stage, and people respond very differently to treatment. So they need individualized rehab to suit them, and just comparing yourself to other people and worrying about where you're at and what someone else is at is not helpful. But also, lots of people that have breast cancer talk to other people that have breast cancer, and you should advise that they go and see, someone, obviously they need the best medical care, but they also should have the best rehab and exercise care as well. And they should go and see some about that rather than just giving them advice of what you're doing.
And I love your tip. Don't listen to Dr. Google, because we all do it. And we all know.
I know. I just heard on the radio actually this morning about people doing Dr. Google.
Yeah.
So yes, it's very common. The other thing I think which is really important is to see a certified cancer rehab physio early, and this is to get advice on how to maximize your recovery and what you can do to prepare yourself for upcoming treatment. It's really empowering if you're proactive and you can take control of things, which there's some things obviously you're not going to be able to take control of, but if you can take control of the things that you can control and know what you can do to help yourself, it's a real positive thing to do while you're going through cancer treatment.
Absolutely.
And then my number 3 is learn to ask for and accept help. You can pay it forward later. And this is a big one for women with breast cancer. I think, they're often, used to looking after everybody else and they put themselves last. But this is a really important time to look after yourself and ask for and accept help. And now, if you do see a cancer rehab physio, they can guide you on the activities, housework, exercise, and things that you can safely do, but also what you should ask for help with while your body is recovering from the surgery and during treatment. So often people have a lot of friends and family members that want to be helpful, but they don't know how to help them. And this is a really good chance to get your physio to go, look, these are the things that you should get getting help with, whether it's vacuum cleaning. Often it's not good for people to carry anything heavy, so they can't carry heavy bags of laundry or carry big bags of shopping. So that's a practical thing they can get people to do for a while, just while they're recovering.
Yeah, really good tip. And we're all a bit stubborn when it comes to things like that. But when it does, as you say, come to physical recovery from, surgeries and things like that, it's really important that we do ask for help and use it when it's...
Absolutely. My number 4 tip is to get any pain, swelling, pins and needles, signs of infection or stiffness assessed early. Now, it's also common to, try and ignore some symptoms and think, they're not that bad. Often also too, women with breast cancer are maybe sometimes trying to hide symptoms so that their family members and things think that they're coping better than what they actually are, because they don't want people to worry. But if you do have any pain, swelling, pins and needles and things, make sure you get them addressed, because addressing signs and symptoms early can save a lot of time and money, improve your recovery time, and prevent long-term problems. So if you get them early, they're much easier to treat and nip in the bud. So please, it's really important if you've got any symptoms like that you go and see a doctor or your medical team or a physio to help you.
So again, don't be stubborn.
Yeah. Number 5 is learn to breathe properly. And this is a big thing that we do with our Pink and Steel programs, is that it takes a huge amount of emotional energy to cope with cancer diagnosis. And this often disrupts normal breathing patterns, which can in turn make it more difficult to relax, sleep well, and cope with treatment. So a cancer rehab physio can teach you how to breathe properly, and that may seem like I can breathe, but the stress and the tension that the cancer diagnosis brings often makes us hold our breath, tense our muscles, and makes it really difficult for us to heal properly. So breathing properly, relaxation can help you sleep better, and it can just make you feel like you're coping. So I really advise people to see a physio to try and get their breathing right, just to cope. And there's lots of tests and things you've got to go through with cancer diagnosis. It's a long journey, and if you can learn these breathing techniques early, they can help you manage lots of stressful situations as they come up.
It sounds so simple, yet it is actually so important to do that right.
Yeah. And the number 6 thing is to avoid inactivity. Move your body. Motion is lotion, as I like to say. So any kind of physical activity can be helpful, even if it's not moderate or vigorous or anything like that. Anything can be helpful. Short sessions are often really helpful. You don't have to go for a big long an hour walk or anything. You can make it just a 10-minute little walk, and several of those during the day can have the similar health benefits to one longer exercise. So just getting up, regularly moving. The type, intensity, and duration of the exercise might need to change from what you've previously done. Yeah. But again, a cancer rehab physio can help tell you what you need to be able to do and safely give you an exercise prescription that you can do during treatment. So of course, it may be very different to what you're used to doing, but by moving and avoiding inactivity, your body will cope so much better with treatment.
Absolutely. That's just the point that's being rammed home, I think, all over the place. But yeah, for sure.
Number 7 is be proactive in your rehab. So it can, it can help reduce short and long-term side effects of treatment. So, for example, when you're going through radiation treatment, there's stretches and things that you can do that help reduce the impact of function and range of motion. So, for example, if you're getting radiation treatment in your axilla, so under your arm, this is affecting not only the skin but the tissues underneath the skin, and will keep restricting and tightening. And if you can keep stretching and maintaining that range of motion regularly and being proactive, you're less likely to get consequences from that, which could be joint pain, stiffness, and problems with strength and things in that arm because you haven't allowed it to move. So be proactive, get involved in your rehab, and do your exercises that your physio tells you to do.
Do as you're told.
I'm sounding very bossy like a physio, aren't I? Okay, the next one is make you a priority. And, maybe probably for the first time in your life, self-care is not selfish or a luxury. It's a necessity for you right now. Save your energy for activities that will help your body heal and feel better. And I really think that's so important, is make you a priority.
Absolutely. It's actually one of the first podcasts in this series is prioritizing your well-being, and that's all about that self-care and how following a diagnosis rather than, dialing that back, it's about dialing it right up and making sure that that self-care is, almost number one on your to-do list every day.
Yeah, and I think people often have trouble with that. They are often not used to putting themselves first.
Yeah.
And, but if they were thinking of someone else, they would be advising them to do that. So, have some self-compassion and really, you will get through this much better if you look after yourself.
Absolutely.
The next one, number 9, is set your intentions on the future. So, look forward. And I think, keeping a journal can be a great idea, and plan for the future. Talk out loud about the things that you're going to do after treatment. And really looking forward, I think, is really important. And that's, advice too for people trying to support someone going through treatment is help them keep looking forward. I've actually developed a journal called 365 Survive to Thrive, and that's particularly for women going through a cancer diagnosis to help, one in terms of it's got a diary at the front, but the back part of it's a journal. And, and there's lots of research that shows writing things down can help you cope and can help you, when you're really anxious and stressed about things, it can help make sense of some of that if you write it down. So, keeping a journal can be a great idea.
Yeah, definitely.
Number 10 is take time to enjoy at least something every day and stay connected to friends and family that can help you do this. So, I think that's such an important thing for us all to do, but particularly while you're going through breast cancer.
Yeah, absolutely. I couldn't agree more. There are some awesome tips there, Lou. So thank you for sharing those with us. And look, if any of our listeners would like to connect with a Pink physiotherapist to commence their cancer rehab or to have an initial chat, what are the steps that they need to take to do that?
Well, we have Pink Cancer Rehab physios now in all throughout New Zealand, Australia. We've got them lots of big centres and in little rural centres, which I'm really delighted about.
Great.
And now in other countries like the UK and Canada and America. So to do it, the first thing to do is just to go to pinkandsteel.com, the website. You can click on Programs for Women and then click your region, and it'll come up with Pink certified physios in your region or region close to you. And you can use the website to hit an inquiry, and then you will get information back about the program and how to get in contact with the physiotherapist.
Okay, awesome. And what about the journal you just mentioned, is it 365 Survive to Thrive?
Yes, you can get that journal from that same website, so pinkandsteel.com. Even on the homepage, there's a link straight to that journal. So we've had lots of great feedback from the journal in terms of helping people, especially going through that treatment phase and afterwards getting back and focusing on the future and the things that are going to help them with a great recovery.
Yeah, I mean, I love that. I know myself, I used, pretty much just a little notebook for all of the jotting down the bits and pieces in the journal and the, those sorts of things. So I'd love to have a look at that book, and I must go on and check out the website myself and have a look.
Oh, I should send you one.
Yeah, absolutely. Well, Lou, listen, thank you very much for chatting to us today on the Pink Movement podcast. We're so thankful to have you and for you to take time out of your day to share your wisdom and knowledge with us. So thank you very much, and hopefully we will speak to you again soon.
Great, Christy. It was wonderful to talk to you too.
Thanks for listening to the Pink Movement podcast. For episode notes, links and downloads, head to thepinkmovement.com.au. Like what you're hearing? Join our Facebook page, subscribe through iTunes, and while you're there, provide a quick review. Want to help out? You can support the ongoing production of this podcast by becoming a patron. Find all the details on the website. The Pink Movement podcast, helping you to stress less, move more, and feel better.